I'm here in Antigua, Guatemala with Nature's Treatment Center. We're here with Dr. Francisco Lopez. He is an experienced Ibogaine provider. He's done many Iboga sessions, and we have a young man with us now who was suffering from heroin addiction. He's 24-year-old. And, I'll let Dr. Lopez explain his case with you.
Okay, hello. Yes, I'm Dr. Lopez. I conducted several treatments since 2008 here in Guatemala. And, the patient that we are talking about is a young guy, 24 years old. And he was suffering from heroin addiction. And for now, he is, after the Ibogaine treatment, he is clean. Around 17 days after the treatment. No consumption, no craving, no withdrawal at all. But for me, the most important thing that I want to notice and point out is that the patient was using benzos in a high quantity every day during several months, even years. And logically, being a neuroscientist, there is not a fast way to make the brain produce the natural neurotransmitter that is GABA, that is suppressed once a person is using benzos. But for me, it's incredible that now our patient is not using benzos anymore, but it wasn't the result of Ibogaine treatment. It was by using a breathing technique from Jason Levy. It's a guy that I have spoke with him just a couple of times, but it's very, very interesting because the patient is not withdrawing. And it's very difficult for me to explain how happened this.
It's very unusual that would ever happen, especially with a young man that was doing 24 milligrams of Xanax every day for a period of how many months, Anthony?
6 to 8 months.
6 to 8 months, and by his second or first breathing session, I should say, he had very little withdrawal symptoms. So I just wanted to get that from Dr. Lopez, how amazed he was that this technique worked for somebody with a history of benzo abuse. So would you definitely say that this technique by Jason Levy is pretty impressive, wouldn't you say?
Absolutely. It's incredible because there is no way that make the brain produce so fast the normal neurotransmitter related with the benzos. That is GABA. The neurotransmitter name is GABA. So there is not a way to make the brain produce enough quantities of GABA to make the patient feel not withdrawals. And the most important thing is that patients that quit benzos so fast are prone to have seizures. And our patient doesn't have any kind of like this. That was my main concern when we were talking about the breathing technique. Mm-hmm. So, for me, it's incredible, and I need to review all the literature related with this.
And would you say this is the first case you've ever seen?
Absolutely, this is the first case.
And how many years would you say?
Wow, more than 25 years practicing medicine.
You've never seen anybody withdraw like this?
No, because the protocol for patients that are addicted or are using benzos in high quantities is to start a very, very slow tapering during a period of almost a year. Otherwise, you'll have a rebound of the excitatory system in the brain. So that's the danger in that situation. But now I need to
investigate more, huh?
Yeah, absolutely.
Okay, very good. And again, this is Nature's Treatment Center here in Antigua, Guatemala. nature'streatmentcenter.com. Thank you very much, Doctor.
You're welcome.
Bye-bye.